custodians. I pay my respects to elders past and present, and I acknowledge the enduring connection that Aboriginal people have to land, waters, culture and community, and recognise that sovereignty was never ceded. Today is National Sorry Day, a day of reflection, truth-telling and remembrance. We honour the strength and resilience of stolen generation survivors, their families and communities, and recognise that the impacts of these policies continue today. We also recognise the important role that the community services industry has played and continues to play in supporting survivors of the stolen generations. Across decades, community organisations and workers have often carried this responsibility with compassion, persistence and care, frequently in the absence of adequate recognition of support. As we gather today to discuss the state budget and government priorities, it's important to remember that budgets are never just financial documents. They are statements of values and choices. And too often the pursuit of so-called efficiencies and short-term savings can push governments towards responses that repeat the mistakes of the past. National Sorry Day reminds us of the consequences when governments fail to listen to communities, fail to invest in well-being, and fail to place human rights and self-determination at the centre of decision-making. It also reminds us of the importance of building policies and services that strengthen people and communities before harm occurs. I'm very pleased to welcome you all here to this policy conversation where we're joined by Professor Richard Eccleston and Dr. Robert Hortle from the Tasmanian Policy Exchange, which is a think tank at the University of Tasmania focused on the big issues shaping Tasmania's future. This afternoon's session is a chance to focus on key elements of the state budget, how the government's spending our money and what implications there are for the community services industry. There'll be an opportunity to ask questions following the presentations, or you can pop them into the chat and we'll monitor that and come to them at the end. And a reminder to pop your microphones on mute unless you're asking a question. It's my pleasure now to introduce our presenters, Dr. Richard Eccleston and Professor Richard Eccleston and Dr. Robert Hortle. Richard is Professor of Political Science and the founding director of the Tasmanian Policy Exchange at the University of Tasmania, where he leads a dynamic team of policy scholars focused on the big issues shaping Tasmania's future. He's recognised as one of Australia's leading policy scholars who has worked with a wide range of government, industry and community partners and published on a wide range of topics and research tackling some of the most significant policy challenges facing Tasmania. And a recent accolade for Richard is being recognised in the Examiner newspaper's illustrious list of the most influential people in Tasmania, alongside the two most recent TASCOS CEOs. And joining Richard is Dr. Robert Hortle, a skilled policy researcher and consultant with over 10 years experience in international development, academia and consultancy in the UK, Australia and the Pacific. Robert was a Rhodes Scholar and has a strong record of managing high quality, impactful research and is an experienced project manager and passionate about socio-economic development in the Pacific and Australia. We're delighted to have both Richard and Robert join us today. We get twice the bang for our buck. Many of you will have remembered Richard and Robert from last year where we had two budgets in the 1 year, and we had Richard unpacking the first budget and Robert analysing the second budget. So they're no strangers to us and we're looking forward to their presentation and the discussion that it will generate. So I'll try and start your presentation, gentlemen, and hand over to you.
Great, thanks, Stephen. I think Rob's going to kick off.
Yeah, well, I'll kick off by noting, in the mathematical spirit that double of nothing is nothing, so doubling your bang for buck is maybe not mathematically great here. Anyway, we'll see how Stephen goes with the presentation, but what we're going to do is to start with give you an overview of the broader budget outcomes, kind of the framing, the narrative, the context that this budget is coming into. And then after that, we're going to go through some of the specific focus areas that we understand are of most relevance to the community sector. It looks like the presentation's going, so I'm going to get my lovely assistant Stephen to flick through slides for me. I think the next one is also an acknowledgement of country. I really can't add anything to Stephen's. Great to recognise today as National Sorry Day. There was some very disappointing reporting I heard on the radio this morning about the lack of progress on the Bringing Them Home report recommendations. So still a huge amount of work to do there, as I'm sure everyone in this group knows. And I also want to acknowledge that the land we're living and working on today was never ceded. If you could go to the next slide, please. So the next slide, when it comes up, there we go, is just a bit of an overview of the Tas Policy Exchange. Hopefully many of you are familiar with us. As Stephen said, we operate in that kind of interesting space between being a think tank and being a research consultancy as well. So we do commissioned research for governments, for peak bodies, for some TASCOS member organisations as well. And try and address those big challenges facing Tasmania. And something we'd love to see from people in the room today is visiting and reading and subscribing to Policy in My Backyard, which is our regular series of relatively short analysis pieces of some of Tasmania's policy challenges. We kind of like to think of it as the conversation, but focused on Tasmania specifically. So I will pass over initially to Richard to walk us through the background for this budget, the context, and to give us an overview as well of the budget's framing and kind of top line outcomes.
Great, thanks, Rob. And we can probably go to the next slide, Stephen. And thanks for the invitation, and also great to see you, Paula, on the call. I know you're not officially in the role as TASCOS CEO, but I think everyone in the sector and other partners such as us are really looking forward to working with you, and there are certainly challenges ahead. We won't go through this slide in detail, but as we all know, not only is it a complicated budget that poses, significant challenges and a whole bunch of questions, but we're also operating in really uncertain times, both abroad and here at home. And I know you on the call are really mindful of that. Economic uncertainty, political uncertainty, but as we all know, increasing need, particularly among the most vulnerable in the community. And, we've got budget pressures, but we need a properly resourced community sector now more than ever, which is what this shared conversation is about. As Rob mentioned, look, the budget was handed down on Thursday, obviously. There's been a lot of coverage, so I thought we'd just provide a really quick high-level overview of what we see as being the key trends, issues. Rob will do the deeper dive into individual portfolios, but what we thought would be useful is, as part of the conversation is, where to from here, and what could be the focus of advocacy. Because as Stephen rightly pointed out, budgets are about choices. Even if you accept, as we do, that the current budget's not on a sustainable footing, but how we can get it back into balance, there are options. So let's just go to the next slide there, and our kind of take on the framing. I think there's a broad consensus, and I'm absolutely in this camp, that the state budget's not on a sustainable footing with the escalation of significant, approaching $1 billion deficits and the associated debt. And as we know, it's really increased rapidly post-COVID over the last 3 or 4 years. So choices need to be made. And really, I think the discussion from here is about the time frame to get budget back onto a sustainable footing, going to that second point, and then what the strategy should be. What are the options we've got, and what are the choices we're making? Clearly, our Treasurer and government have made choices about spending restraint, efficiency dividends doing the heavy lifting, as well as relying on some pretty significant revenue uplifts, both in terms of the GST and, a risk to this whole budget is the fact that despite the economic uncertainty, federal tax changes, which I broadly support, they're still forecasting really significant increases in stamp duty, for example, which, I don't think will be realised. So I don't think I quite use the language of our Treasurer, and I heard him running around on Friday quoting Margaret Thatcher as well as the Bible. But we do need to rein in. We do need to get the budget back on a sustainable footing, but we need to do it in a way that doesn't damage the community and also supports key services, including those provided by you that the community depends on now more than ever. So next slide, thanks. One thing that, well, it probably didn't surprise me that there's a serious commitment to budget repair, although there has been in the past few budgets and nothing very much has happened. What did surprise me, I guess, is a pretty aggressive approach with significant risks. So really, depending on which measure you choose to focus on, we're looking at returning the budget to a balanced position over the next 3 years. It's interesting, even Treasury's sustainability report, which I think was pretty much on the money, was sort of talking about a 5-year scenario. Having said that, there are huge political risks, I guess, with, assuming that a government can maintain a budget strategy going into an election campaign and then beyond it. Because if we look at history and, no surprises politically, it's in the lead up to election campaigns where fairly extravagant commitments have been made, which ultimately puts the budget under pressure. Really like this chart from our colleague Lockie Johnson, which basically demonstrates that for the last 10 years, state governments have made commitments to rein in spending, and they're the little blue lines. That's the projected spending at each of the budgets over the last 10 years. But the red line shows you exactly where real spending has gone. So despite years of commitment, I guess consistency is a good thing. The government's been very consistent at promising savings but being unable to deliver them. So that's a big question around this budget. As I mentioned, there are also really 2/3 of the budget repairs coming from additional revenue. Most of that's from this GST uplift, which is really welcome, about 1.2 billion over the next 4 years. But then when you ask the question, where's that come from? It's really because of the modelling from Treasury in Canberra has plugged in higher inflation and higher costs, which will mean more revenue. But as you know, when we're having the discussion around indexing community sector grants, the costs of delivering services is also going up. Yet in this budget, they're assuming that costs are coming in at about 2.5%, which is going to be difficult to achieve. So that's the broad strategy that the government's trying to pursue. If we go to the next slide, we've probably seen the numbers, and they do get confusing in state budgets, but basically having run increasing deficits over the last 4 years, out to $1 billion, a really dramatic correction in terms of the budget, and driven, largely by, with savings and efficiency dividends. And Rob will look at this in a minute. If we compare that with what actually inflation's forecast to run at, across a lot of the key portfolios, we're looking at pretty significant real funding cuts. So, fewer resources in most of the main spending items. The other part of the complicated budget is obviously broader government businesses and their escalating debt, and also things like unfunded superannuation liabilities. But I think they've been discussed at reasonable length. So next slide, Stephen. Probably all seen different versions of this chart, and this is just where the Tasmanian government spends its money by activity. As we all know, one of the key funding responsibilities and drivers of cost pressures is obviously health, education, but also the broader spending around social protection, broadly defined, much of which is funded through grants and delivered by you. Final, I think, slide from me before I hand back to Rob is this question about where's budget repair coming from? There's a tax piece. I think, credit, there's a lot of uncertainty around where the savings are going to come from and where cost cuts are going to fall. But at least, and I think the Treasurer has been clearer about this, at a high level, they are indicating which portfolios are required to deliver savings, operational savings. And they're broadly, in proportion to the size of the portfolio. So as you can see there from that table, which is out of the budget papers, health is required to find $700 million in operational savings over the next 4 years. Education, and they've been talking about, a discussion around back office staff cuts there around 227 million. Justice seems to be particularly hard hit when you look at it by portfolio size. But the other complication here is just all of the administrative changes and changes in the machinery of government, which haven't been applied to this budget. So it's kind of hard to work out what is sitting where. We've been asking some questions about how these figures are reflected in the broader budget papers, and they're not really, other than the fact that each of these are kind of savings line items. So each of the agencies will be required to make an argument about how they save this money. But the budget, but through the budget, we can't determine where within a huge portfolio like Justice or DSIP, those savings will be achieved. So that's, part of the ongoing kind of advocacy and awareness effort, I think. So that's a high-level overview of the budget, and I might just hand over to Rob for a quick 10-minute take in terms of the individual portfolios and announcements. Some of those you will have seen, but I think it's worth going over them, and there are some really important common trends, I think, for us to think about. So back to you, Rob.
Thanks, Richard. If you could go on to the next slide, please, Stephen. We're going to have a look at health first of all, because as we've seen, it is the biggest chunk percentage-wise of the state budget. And also I thought it'd be good to give a little bit of a spotlight to it as well, because there's been a lot of argy-bargy in the media over the past few days that no doubt many of you have been following around whether this budget actually contains cuts to health or increases to health spending. And I'm going to have a crack at explaining that, so you can let me know how you think I do. The key thing is that across the forward estimates, which is those 4 years of budget predictions out to 2029, 2030, health spending as a total is expected to go up to 3.87 billion. Now, importantly, that's about a 1.6% increase per year, whereas in the previous decade up to 24-25, we saw health spending increase at 8.5% per year. So again, that's just showing, some of those potentially ambitious assumptions about reining in spending. Really important to note for this group that there is funding in the budget for preventive health strategy, so 5 million a year for that over the forward estimates. And also Tassie Doc has shown up. People might remember that being an election commitment. So the Liberal government is putting in money to expand bulk billing GP clinics, and they're funding the literal physical expansion of those generally. So they're funding the infrastructure in a few different clinics. Then these operational efficiencies, so 700 million across the forward estimates. And we've got some examples here because health was one of the portfolios which in the budget papers put in some quite specific examples of how it was planning to deliver these cuts in spending. So they're talking about improved cost recovery. So that's co-payments, fees and charges, things like revising their executive structure. So that's code for sacking some of the more higher paid people potentially. They're talking about consolidating corporate and policy functions, so trying to not have duplicated, HR functions across different areas of the department, consolidating their office accommodation and trying to spend less on consumables, so, office supplies, staff travel, and so on. So if we go to the next one, please, Stephen. And what you see here is the dark blue bars are the amount in percentage terms that health spending has grown each year. So you can see that massive, it's off the scale. The COVID year increase was 28%. But other than that, this is where we get the kind of 8.5% average per year. And then the light blue ones you can see are projected across the forward estimates. And so you can see that as a per year percentage, it drops pretty significantly in terms of the increase. But then the really crucial thing here is we've got CPI in there, so the Consumer Price Index, which is an indicator for inflation. And you can see that in the past, generally, health spending has been higher than CPI, which means that in real terms, the amount we're spending on health is expanding. That increase isn't being eaten into by inflation, which is the increasing cost of delivering services. So in future, though, we can see that health spending as a percentage is meant to fall below CPI. So that means that even if in nominal terms it looks like an increase in health spending, in practical terms, what it really means once you account for inflation is that it's a real world cut in a lot of ways. Whenever that bar falls below the inflation line, that's a real terms cut in spending. And to the next one, please, Stephen. So this is where I try and make sense of what's going on in the media. So people will have seen the government has said that health spending in the budget is increasing by 264.8 million. Now, it took me a while to figure out where they're getting this number from, but I think I've nailed it. And it's not intuitively what you might expect. So they're not saying that they're spending 264 million more over the next 4 years. That's not it. What we're doing here is we're taking the 3 years that are the same between last November's budget and this current budget. So you can see them, the columns, 26, 27 out to 28, 29, 3 years that overlap in those two budgets. And then what we're doing is comparing the amount that the government is spending in those 3 years. And when you add up across those rows, you can see that in 26-27 budget, they're projecting that they'll spend 264 million more over those 3 years compared to what they said they'd spend in 25-26. So hopefully that is a slightly more simple explanation. So this is where the government bases its claim of increased funding. It's increased compared to what they said they were going to spend in November 25-26. Now, if we go to the next slide, please. What we've got here, and this chart, it's a bit of a proxy. It's not an exact science, so please don't use the numbers from this exactly, particularly that top blue number there. So the bottom line that you can see is the amount that the government has said it will spend on health in this budget, and it's a very specific amount, so it won't match up to what you saw before. This is the amount the state government specifically has said it will spend on health. So we're excluding all the federal funding that comes to health, and that's quite a lot of money. So that green line at the bottom, state government spending on health, and then we've got these operational efficiencies that are written into the department's budget each year. So, you can see 131 million in operational efficiencies in the first year and then 193 million out in 29-30. And if you add all those up, you get the 700 million in cuts. So what I've done here is if you add those operational efficiencies onto what the state budget said it was going to spend each year, you kind of get the implicit or actual spend. What they would have spent if we didn't have these operational efficiency cuts. So that's where you get the 700 million that people are talking about cutting. We can come back to that later. I know it's complicated, sorry. I wish I was in a room with you all to draw squiggly lines and so on and try and make sense of it. But if we carry on, Stephen. Having a quick look at housing. So there is a decrease this year in what's allocated to housing and community amenities compared to what was listed in 25-26. Of course, very important that Homes Tasmania is receiving a large amount of funding, $500 million over the forward estimates, including federal funding. But we're not entirely sure. Well, Homes Tasmania is going to end up in Building Tasmania, the department that's replacing Department of State Growth. And Building Tasmania is starting on July 2nd, but Homes Tasmania won't be folded into it until a bit later. And if you want to track some of the progress in housing, of course, I'd really recommend the TasCos dashboard, which shows some of the challenges and the progress we've made. If we go to the next one, please. We'll skim over this pretty quickly. It's basically the same chart you saw for health. The blue bar is the percentage growth in infrastructure spending versus the orange line being CPI. And so we can see that in the past, infrastructure spending has been pretty volatile, but in future, it's projected to decrease a fair bit over the forward estimates. Now, important to note that this infrastructure spending doesn't include housing and homes specifically, but it does include a lot of the broader infrastructure that you need to go around those houses. So each year, about nearly 50% of this infrastructure spending is roads and bridges. Next one, please. So we're looking at education here. So again, an increase in spending, but hold your breath for the comparison to inflation on the next slide. We saw strong support for food to support learning and wellbeing there. That's the school meals program, one of the biggest line items, and a decent capital investment in school upgrades and teacher accommodation as well. Now, DSIP, the broader department, is an interesting one because they're one of the only departments that specifically talked about reducing back office staff as part of delivering their operational efficiencies. They didn't absolutely say we will do this, but they said in the budget papers, if we reduced our back office staff by 10%, that might get us close to where we need to be. And just a quick note, the figure I've got up the top there for education is very specifically primary and secondary and other education services. It's not the entire DSIP budget because DSIP, of course, is much broader than just education now. Next one, please. So here we can see how well education funding might keep pace with projected inflation over the next few years. And again, it looks like in real terms, it will be a cut in funding. Bearing in mind that if we're being pessimistic, these inflation projections might be a little bit too optimistic. There's a decent chance that inflation will be higher than what's listed here. Next one, please. So looking at the Commission of Inquiry and support for children and young people. So there's a fairly hefty decrease in funding through here, and the general narrative that you'll see in the budget is that that's because actions in response to the Commission of Inquiry are essentially winding down. Really important to note that for out-of-home care, there's 100 million across the forward estimates, which is really good to see. There's that continuing funding for the Commission for Children and Young People as well. But the children's services line item, which includes services for children and families and youth justice services, is experiencing a pretty significant drop across the forward estimates. Also noteworthy is $110 million next financial year after next, 27-28, to replace the Ashley Detention Centre. So that's allegedly for the new detention centre at Pontville, if that all gets approved. Carrying on. So again, we're looking at the Justice Department's expenditure because quite a few of those Commission of Inquiry and so on bits and pieces, the ones that aren't in education in DSIP sit within Justice. So again, you can see pretty hefty decreases in the Justice Department's projected expenditure over the forward estimates. And then finally, for my section here, we want to have a look at social and community services more broadly. So the budget explicitly says that indexation will be at 3% per annum for the coming financial year and the one after that, and then it'll be 2% per annum for the rest of the forward estimates, unless that is renegotiated at some point. We've seen the continuation of some really important cost of living initiatives, including the Energy Hardship Fund, at least until the year 2029. We saw that was it 500,000, I think, increase in funding for food banks, food relief services across the state in response to the fuel crisis. So that's in there. And of course, free public transport continuing up until the middle of next year. But concerningly, as Tascos has pointed out, we see a 13.5% cut across the forward estimates in the funding for the community services line item in DPAC. And there's also no new funding beyond 2 years out into closing the gap. But I would assume that that is because they're waiting on more funding to be announced from the federal government for that. Cool. So that's a whirlwind tour. So if you go to the next slide and then the one after that as well, please, Stephen, we'll have some conclusions and Richard's going to kick us off with this idea of budget trade-offs. Oh, you're on mute, Richard.
Thanks, Rob. Really looking forward to opening it up to questions, but it's a significant budget, pretty radical budget repair with potential consequences, and trying to achieve really unprecedented and perhaps unrealistic savings despite high inflation and high need. The question is, what are the choices and what are the options? And I think, this budget's going to go through Parliament most likely. But in terms of advocacy over the coming years, what are the other pathways back to financial sustainability? And we published on Budget Eve a piece of work looking at those options, and you can see the link there, and Rob's mentioned the PIMBYs. But our view is that thinking about promoting long-term community welfare, well-being and prosperity, perhaps a slightly more gradual approach to achieving savings. We certainly need probably a reprioritisation of what government focuses its effort on. There's not much evidence that you can achieve 5 or 10% savings in a portfolio without fundamentally refocusing, the work of that portfolio. Things need to change. We and I absolutely acknowledge that there's scope for public sector reform, but that takes time and often upfront investment. Trying to achieve really ambitious savings while also redesigning service systems, funding models to achieve long-term outcome, is really difficult. This government has chosen to not include any tax measures. As far as we can tell, there's very few reductions in terms of business funding and business subsidies, and to achieve budget repair through the savings measures and cuts that we've been talking about. We outline it and we've argued it in the past. There are opportunities for modest revenue increases, and it actually was in the health portfolio budget, perhaps user charges for those Tasmanians who can afford to pay for services. We also, it's a slightly different category of spending, but we do think, given the budget challenges we're facing, that capital spending could be postponed or reprioritised. And again, there's not much evidence of that in the forward estimates. And the one question, and this is sort of a segue to the discussion, is what I fear and what we all fear and what we've got to draw the public's attention to and advocate for is to preserve funding and grant funding for the delivery of community services. And Rob will sort of wrap this up. But as we know, it's often a politically convenient way to save money. When important funding contracts and funding agreements come up for renewal, if they're not renewed or if they're cut significantly, it's not explicit in the budget paper. There might be a steady stream of articles in the paper or something like that about programs being cut. But as we know, that's completely, often counterproductive in terms of cost-effective service delivery to support the most vulnerable Tasmanians. I know you've all been talking about this and thinking about it well before the budget was passed down, but unfortunately, I think that remains a real risk. So I might wrap up on that slightly gloomy note and then pass over to Rob for the final kind of proposal or thoughts about advocacy and what collectively we can do about the situation we're facing.
So as is tradition, we always try and end these presentations with a new idea or a slightly positive note for you to take away. I should emphasise this isn't something we've discussed with our friends at TASCOS, so it may well be something they're already thinking about doing, or they may look at and go, oh gosh, really, do we have to do that as well? But I don't think so. So what we're suggesting here is, as Richard said, a lot of the cuts to the community sector that we're going to see over the forward estimates will be through the grants and subsidies line items in the budget. And they're really difficult because they're important, but you don't get detail on them in the budget. And of course, as you'll all know, most of your funding comes from these grants and subsidies, which involve, short-termish contracts to deliver services that the government doesn't want to or doesn't have the expertise to. So it's going to be really important, we think, as the full implications of these cuts come to light, that as a sector, we really keep track of when those contracts are being cut, not being renewed, or so on, to try and build up a really holistic picture of the full impact of these cuts on the community sector. So I don't know if there's a possibility of TASCOS running something similar to their public housing dashboard, which has been such a fantastic resource. Can we have a public dashboard where we keep track of contracts not being renewed or being cut to try and chart that overall impact on the sector? So just a little potential idea to finish with. And we're really looking forward to taking questions from you. So perhaps, Stephen, we can go to the final slide and just leave it there as we take questions from the floor. Thank you, everyone.
Thanks very much, Richard and Robert. And Robert, yes, you have preempted a closing comment of mine about capturing some of this information. So I'll address that as we wrap up the session. But we can open the conversation up now to people that have got some questions. If you want to raise your hand or put something in the chat. Got one of the first questions here is around, this is from Kate Pennington, and if Kate wants to jump in and add any more context to this, is there evidence of how the health spending cuts have been considered in terms of population growth and age projections?
Thanks, Stephen. Yeah, it's a question weighing on me heavily as I watch our East Coast population grow quite rapidly and age quite significantly at the same time. And our rural communities really feel the already reducing services. I guess I'm looking for the evidence that was informing their budget cuts in health and savings in health, despite state projections for population growth and growth in age.
Yeah, look, a good question. I can see that Lisa Denny's on the call as well. I guess going back to the beginning, part of the headwinds that we're facing are increasing need, and part of that in terms of the health system is demographic. And we know that particularly hospital care and need for that increases dramatically with age. from a health system point of view, there's a lot of merit in centralisation. But we've got a dispersed population, and because of lifestyle and livability, there's very strong evidence that retiring Tasmanians are moving to the coast. And we did a piece of work in northern Tasmania that demonstrated that. So there are tensions. What is cost effective care delivery and healthcare where people live and where they need it. Having said that, I mean, if you just look at the numbers, there are issues in terms of the productivity of the public sector. I mean, first of all, it's difficult to measure. We don't really measure outcomes and whether services are truly effective. And I know everyone on the call has been thinking about this debate. But if we look at the actual quantum of services provided in the state sector, there is a bit of a productivity crisis. I mean, the headcount in the state sector has increased by about 40% over the last 10 years. Population's increased by about 10%. And if you look at the Productivity Commission's data, and they caveat to say that it's really just activities rather than the quality of care, but the quantum of services hasn't increased. So, look, there are challenges there. And, we do need, I think, a discussion of what are the key roles of the state government in terms of service delivery, and how can we reform that, and how can we partner with you, the community sector, around high quality, sustainable care. But that's a huge agenda, and doing that in the context of pretty brutal budget cuts is difficult. So, haven't really answered your question, have I? Maybe it should be in politics, but it's a really good one and a challenging one.
Thank you.
Yeah, I guess I'd just quickly add to that and say that, the spending across the board estimates would have been informed by looking at the TasPop projections. And I defer to Lisa on the call about how realistic or accurate those might be. But yeah, it really is down to the fact that the government has taken its sort of current ideological choice to focus budget repair on spending cuts rather than other things like revenue raising measures. So it's essentially saying, here's the amount of money you've been given. You've got to try and deliver as good services as possible with that. Which, as you've said, if we have a population with increasing needs because of age and so on, that's kind of they're saying, well, so be it. Sorry? Oh, no, someone on mute. So I think that if we want to, there's a broader discussion that we can have there as a society, right, around what level of service do we expect as a society, and what are we willing to pay for that? Are we willing to pay more taxes to get a higher level of service, or, to charge more taxes on business, on industry, and so on? But that's a much more fundamental question about, do we want to be a Scandinavian type country, or do we want to be like the US, where it's a user pays model? And that's kind of beyond the scope of this specific budget, I suppose.
Thanks, Robert. I've got a hand up from Victoria Street Meeting Room. I can't quite see it. Is that Sark?
Thanks, Stephen. Yeah, it's Sark. Hello, I'm Jenny from Anglican's. Sark and Beth. I have two questions, so feel free to just answer one if I'm being too greedy. I don't know where that's coming from. Can you hear me?
Yep.
Awesome. So I guess, do you have any ideas on how to advocate for the fact that if they increase their investment in housing, particularly social and affordable housing, that would deliver recurrent budget savings in health? Like, for example, people presenting less frequently to the emergency department due to mental health. That's question one. And question two is, do you have any thoughts on, obviously it's a political issue, but introducing a broad-based land tax and sort of getting rid of stamp duty in its current form?
I'm Jenny. Yeah, good questions. I'm happy to come in there quickly. We all know that well-designed preventive programs deliver long-term savings. But there are a bunch of challenges there. How do you measure it? How do you prioritise? The returns are going to be 5 years down the track, and because of our system, we tend to focus on the next time horizon. There is some good work coming out of Canberra actually around future avoided costs, and I think in the federal budget last week there was about $30 million on the back of the work that the Productivity Commission did, including Angela Jackson, who's got strong connections to Tasmania, about having a national model and an agreed methodology for trying to work out future avoided costs. It started doing in Victoria, but nationally then starting to invest. And the state government, and credit to Bridget Archer, there's hardly any funding for that preventive health strategy, but I think she is keen to develop at least a framework so that we can really try to understand in credible and consistent ways what the benefits of prevention are, and then thinking about a way of investing in them. And having worked a lot on housing over a long period of time, which is a bloody frustrating thing to do, we know that access to secure and suitable housing is the best social and economic infrastructure we can have, and so many of our challenges are caused by insecure housing. So there is work that's been done nationally, and hopefully the state government leans into that. Now the second question. Oh, I've lost track.
Next one, Richard. So the second one was
tax.
About moving from stamp duty to broad-based land tax, and I know Richard will want to come on in on this afterwards because it's his hobby horse. But yeah, certainly shifting from a stamp duty, which in our view is a bad tax. It's unpredictable, and it's regressive, and it's kind of flat across. It doesn't matter what your income is, albeit they have the stamp duty exemption at times for first-home buyers. A broad-based land tax would be a much more stable source of revenue. It would be able to be indexed to be more progressive as a tax, so that it could be used to only target the wealthiest Tasmanians. So previous work that we did at the TPE found that if we had a 0.4% tax on the value of all homes over $1 million in Australia, which is at the time was about 15%. I suspect it's probably more than that now, actually, Richard. But that would raise about 60 million a year. So that is definitely something we've been arguing for a while, but land tax is not politically palatable.
And that's in that PIMBY. I mean, we did a big national study with Saul and others on this 2018 before that 2019 federal election, but it might not be right because I was doing it with AI, but just modelling, just a surcharge, an annual surcharge on properties above $1 million, that'd raise $60 or $80 million a year, and you can do it through council rates. So there are options there, but it's a question of political priorities. I think I can see Rodney with his hand up.
Thanks, Richard. This is a completely out of the blue point that came to my mind when you mentioned that the budget will probably pass. It probably will. It usually does. If it's the case that there's been terrible cutbacks to community services, and we know there has, and if it's the case that there's no proper revenue raising measures proposed, why can't we just ask the upper house to block it and send it back until there are revenue raising measures included?
Yeah, no, good question. And I guess I've got fairly conservative views on this from a sort of political science point of view. We talk a lot about Westminster conventions, and they're kind of a movable feast. But generally, and we saw this last year, and my counsel to crossbenchers would be that you need to be very careful in terms of trying to amend budgets or block budgets, because the usual response there is to, is effectively a no confidence motion. And this is part of the discussion we need to have as, the traditional parties fall apart and we need different ways of governing. So I'm all for an active parliament, but when there are spending implications, we need to be careful. So I guess my conservative view, Rodney, would be absolutely we need to advocate, and as we've seen over the last 5, 6, 7 years, that I would see the window of opportunity being in terms of the development of the next budget, is at 27, 28, to get the government to reflect on its priorities and their implications for the Tasmanian community. So that's one response that I'll acknowledge comes from a fairly traditional or conservative sort of reading of how a Westminster Parliament deals with budgets. But a good question.
If I can just have a follow-up, sorry everyone. Yeah, well, obviously, I was someone who advocated for the Legislative Council not having these powers right through the 1990s because it kept blocking legislation. But we in Tasmania we used to have mechanisms for resolving disputes between houses. We had managers' conferences and things like that, which no longer exist. It doesn't have to be a 100% win-lose situation when it comes to the Legislative Council, or for that matter, the House of Assembly, blocking a government budget. I know that it can be seen as a vote of no confidence in the government in the House of Assembly, but that's not necessarily the case in the Legislative Council. There may be ways of demonstrating displeasure with the budget and holding up its passage that doesn't lead to greater political instability, but which leads to a more, and I think it might have been you that referred to this, a more European outcome, where there's more people involved in a budget rather than just in the formulation of the budget, including revenue raising, than just a minority government or a small part of a minority government. I don't see why those points wouldn't be explored if we're dealing with what for many vulnerable Tasmanians will be a budget that creates a crisis in their lives. I mean, it's easy for us to talk about, no offence, you're right, it's easy for us to talk about conventions and Westminster politics and all the rest of it. But if it's as serious as we all know it is, then why wouldn't we look at options for ensuring that it could be made better?
Yeah, look, I agree. I mean, we and others advocated for more of a multi-party approach to developing this budget in the aftermath of the last election, and when it was very clear that there was going to be a minority government with difficult decisions to make, and that should be a more open and consultative approach. I think Ruth Forrest and others have proposed, a citizens' assembly as another kind of, at least advisory kind of function that can try to bring more people into the discussion. So, look, I agree with you. Given the nature of politics and the challenges that we're facing, that we do need a more inclusive and negotiated approach to forming budgets. Be keen to chat or any of this, and anyone on the call very, very keen to have a discussion afterwards.
Thanks, Richard. We're nearly at the end of our time, but I've got a question in the chat from Patty Chugg, CEO of Shelter Tas. She asks, do you take into account the debt from GBE and statutory authorities? And is this a mechanism to keep the state debt down or off the books? And what's the best way to track those debts as well?
I can start up with one, Richard. So I think we had in one of the early slides that the general government net debt, which is the kind of all the core agencies that we think of, is projected to hit 10 billion by mid-2029. But then if you do include all of the government businesses, Hydro, Macquarie Point Development Corporation as well, that net debt is up to 18 billion. So there's about 8.4 billion that in debt that's hived off with those, what are they called? Public non-financial corporations, I believe the technical term is. So yeah, it is to some extent a way of shifting debt away from the central government, but it's really important to note that, for example, the international ratings agencies take into account that whole of sector debt. So they would be looking at that 18.4 billion, not the 10 billion. Richard?
Yeah, look, the Tasmanian budget's, I think it's more complicated than the federal budget in some ways, because you need to think about the money coming from Canberra and then also the relationship with our 14 state-owned businesses. Again, the news isn't good. Traditionally, the state government in recent years has been propped up by dividends from government businesses that probably should have been going into maintaining those businesses. But what we've seen through mismanagement, and I'm thinking about the Spirit of Tasmania, is a whole bunch of government businesses now need additional equity or capital. And I think over the forward estimates, there's about $1.8 billion of funding going into GBEs as additional equity now. And that's partly how the stadium's, going to be financed. So on a good day, that might be investment in productive infrastructure that would provide a return to Tasmanians. But I suspect that a lot of these equity injections probably won't. So it's a complicating factor, Paddy, as you well know. But my other observation in terms of this budget is the capital flows are going to be going out into those businesses, which is another burden on the budget, and it does show up in terms of that whole of government sector reporting. But it's another complicating factor.
Yeah, I think there's about
thank
1.
Yeah, thank you. I know the time's running out. Just the Homes TAS is a statutory authority that has to go back into government, so maybe it's a question for later on. Thanks.
Yeah, thanks, Paddy.
Well, as Richard said, very happy for Stephen to pass on our email addresses and to have follow-up discussions, meetings, catch-up coffees with people. It's what we're here for and what we like to do to try and make sure everyone has the information they need.
Great. Thanks very much, Robert, and thank you, Richard. Really appreciate your efforts. Not just your time today, but the resources you've put into the presentation and supporting this event this year and the 2 last year. We really appreciate the engagement we have with the Tasmanian Policy Exchange and how you support our events. For anybody who hasn't taken a look at the PIMBY website, I encourage you to do so and sign up to the newsletter. Some really good stuff comes out of that. And as I said, Robert preempted our closing comment that we were going to make, and that is around TasCos is interested to get a clearer picture of where the funding gaps are, where the projects are ending but haven't been recommitted through the forward estimates, where organisations are still seeking clarity around their funding arrangements, because it's not easy to see from the budget where efficiencies or savings are being made. We haven't quite worked out how we will capture and present that, whether it's a dashboard or some other medium. But if we have the opportunity through budget estimates coming up to ask some questions of ministers, TasCos has regular meetings with Minister Ogilvie, and then we've got our other policy advocacy that we can use to track this as well. So if members want to send through any outstanding queries or questions they've got around their funding streams, any projects or programs or election commitments that are ending or that they're not yet aware of that are being continued, please send them through to myself or any of the other TasCos team, and we'll capture those and work out a way to present those for a bit of transparency and to continue our advocacy to government. So with that, I will thank everybody for your time this afternoon and for attending. And let's hope it's the only budget for the year. And we'll look forward to doing this again in 12 months' time. Thanks very much again, Richard and Robert.
Thanks, Stephen. Cheers, everyone. Take care.